Okay, well, we'll make a start because that is 6 o'clock. Well, good evening, everybody. Welcome to the meeting. We're going to go straight in, first of all, to presentation from Sarah Baines, who's been at a number of our meetings over the last few months. And Sarah's the lead for Integrated Care Community Development at Royal Lancaster Hospital. So basically, Sarah, over to you.
Thank you. I'm going to share my screen if that's all right. So I might lose you, as in I can't see you. So just let me know if you can see it, if that's okay.
Yep.
That's it, Sarah. Okay, yeah.
Brilliant. Okay, fabulous. So good evening, everybody. Thank you. Yes, so I have been coming to the meetings for the last few months, but I've kept myself quiet because I think I ended up in the meetings accidentally. I think David sent me a communication and I accepted it and I came, and I have been coming ever since, but I've kept myself quiet because I'm not really sure what I can contribute at this time. I've been sussing out kind of what you do and how I can fit in, really. But I am a new member this year of the Lancaster Civic Society as well, mainly because one of my great passions is history, and I love kind of visiting old buildings and learning about them and preserving them. So that's why I got interested in the first place. So thank you for having me anyway. So if I just tell you a little bit about myself before I go into my role and what I do. So I worked in private industry for 23 years. And then I had an epiphany and went to train as a nurse at 40. I went to university full time. I was one of the oldest students, but I loved every minute of it. And then I was a district nurse in Carnforth and the surrounding areas for 9 years. And then Morecambe Bay CCG came up with these new initiatives called Integrated Care Communities. So I worked in the Carnforth one for 12 months and helped to establish that. And then I came to Lancaster in 2017 to develop the one in Lancaster, and I've been doing it ever since. So I'm employed by Morecambe Bay Hospital Trust, but I actually work in the community. And what I mean by community is that I'm literally out and about meeting groups, people. I'm not in a doctor's surgery. I'm not in the hospital. I kind of go into them, but I'm everywhere, everywhere and nowhere. So if I give a little bit of background about integrated care communities, I'll just move my slide on. So in 2015, Morecambe Bay CCG, Clinical Commissioning Group, were given some Vanguard money, excuse me, by NHS England. And it was to try and establish new ways of working to relieve pressures in the health system, and that's primary care and secondary care, because even before the COVID pandemic, both were in crisis, and basically they were at breaking point with demand outstripping capacity and the resource that was available. So Morecambe Bay came up with that Vanguard plan to develop the concept of ICCs, Integrated Care Communities, but I'll refer to them as ICCs. So as you can see, there's 8 of them across Morecambe Bay, and all of them are centred around one large GP practice or a cluster of small GP practices. When I came in 2017, Lancaster was actually 2. It was centred around Lancaster Medical Practice, which at that point was joining the 4 old legacy practices together, which was Dalton Square, King Street, Rosebank and Owen Road. And Queen Square was one on its own. But I was one resource right across the whole of the Lancaster district. So basically, to prevent duplication and save time and money in the NHS as we need to, because both practices serve the same geography, the same demographics, we join them together. So we've now got Lancaster ICC. We've got one in Morecambe called Bay. We've got one in Carnforth. We've got one in East, which covers a lot of the outlying areas like Sedbergh and Kirkby Lonsdale. We've got Kendal, we've got Grange and Lakes, we've got Dalton, Ulverston and Askham, and we've got Barrow and we've got Millham. So in each of those, there's a me. The purpose of ICCs is to provide what we call place-based care and commissioning, because what we found was a lot of the issues or health issues that might be affecting Lancaster were not the same and didn't have a high impact in places like Kendal or Carnforth or Barrow. We were all seeing, we had common themes, but a lot of us had different key issues. So what we wanted to do was to commission, micro commission, if you will, into our areas, services that were going to be used, because basically we were trying to prevent wastage and not use services that weren't needed. So in the ICCs, we've got 4 roles. We've got a clinical lead, which is generally a GP, so it'll be a GP from that area. We've got a development lead, which is me. We've got care coordinators, and we've got an administrator. So ICCs are unique to Morecambe Bay, but on the back of the work that we did with the Vanguard money we got from NHS England, many of the regions right across the UK are now developing something called neighbourhoods, which are a very similar model to what we did. When we fed back, we had a programme, a 3-year Vanguard money, and it was a programme called Better Care Together. And we fed that back to NHS England, and that has been rolled out, and other people are now developing similar models across the country. So in those roles, our administrator obviously supports us administratively. The clinical lead's time is normally half to 1 day a week, and they're there mainly to provide strategic commissioning support both to the CCG and myself. The care coordinators will receive referrals from anybody. People can self-refer, or anybody can refer to a care coordinator. They are based in the GP surgery, but they work for the ICC, but they've got very close links to the GPs and the hospital. And they work with individuals in their own homes who might have complex or multiple health needs. They'll see people that are experiencing poverty, addiction, poor mental health, physical issues, and even social issues, or a combination of all of them. My role has 2 purposes, really. Firstly, to identify the key health issues that are affecting the residents that are living in Lancaster, which is my area. And I do this through predominantly data searches. So I use primary care data, I use secondary care data, I use council data to really drill down and see what the issues are. But I also go out and listen to the community as well. I literally pound the streets, talking to people, going to groups, listening to what's going on to find out what's important to them and what the key health issues, or what they feel the key health issues are, or the determinants of health, the things that are affecting the health in their community. So that's one part of my role, is to find out what the issues are. My other key role has been to develop relationships that then form and establish effective working partnerships, so that basically all the different services, all the supportive groups can work better together to improve those health issues for our residents, really. Because what we found was, and I'm sure you'll all know this, a lot of us are probably seeing the same people, the same issues, we're having the same conversations, same interventions in some cases, and just duplicating resources, and it's just daft. So the aim is for us all to come together, and that's public services, emergency services, support groups. It can be absolutely anybody. We use people in the community that are running small groups. It can be absolutely anybody. And we work together to try and solve those issues. So every 2 years, I've been producing a detailed analysis of the health profile of Lancaster, and I break it down by ward, and I break it down by all the determinants of health and health conditions. And just if anybody is interested, I can share it with you, but just to warn you, it's massive. So the one I did earlier this year in February 2021, I think it was 204 slides, but it is really interesting if you've got an interest in health and you want to know in Lancaster, particularly where those health issues are. So I can share it if anybody wants to get in touch with me. So I do a lot of data analysis, but I also do a lot of door knocking and just introducing myself and starting to build up really good contacts and relationships. What I also established 4.5 years ago now is a monthly meeting. So we have monthly ICC meetings where I call them our ICC partners, all come together. They're all invited, and we've got over 120 different partners just in the Lancaster region now. And that's made up of community groups, public services, charities, churches, schools, absolutely anybody who's got an interest in health and wellbeing in the district. And every month now, because we obviously moved online with COVID, we were getting about 20 to 25, sometimes 30 people coming face to face to meetings, but we're now getting upwards of 50 and over 50 people coming every month because it's a lot more accessible. And we come together and we share what's new in our organisation or our group, what's changed, what's stopped, and we support each other with new projects, new initiatives. And if if a certain group or a certain service has got, a client that they're really struggling with, the networking that goes on at the ICC meetings allows them to have direct access into another service that they wouldn't necessarily have been able to get through to the right person or get through to them at all, get through to that service. So off the meeting, a lot of our partners partner up and work on projects, but also do joint visits and joint support of individuals as well. So it can be big project stuff, or it can just be working with one person. So I just want to show you some slides quickly of some of the stuff that we've done in Lancaster with the ICC. And these are ICC initiatives that we started on the back of the data that we looked at and the people that we spoke to. So one of the very first things that I noticed from the data was that alcohol has got a particularly high number of hospital admissions for alcohol-related injury. It's not the highest, but it's one of the highest. So one of the first things I did was talk to one of our substance misuse partners in Lancaster. In fact, I spoke to two of them, and they hadn't previously worked together. They were doing separate things, working with the same people. One was a treatment provider, and the other was a peer support group. They've come together and now run a clinic every Friday morning in Dalton Square Surgery, where people can access either low level or crisis support around alcohol and drug misuse. What we found was a lot of people weren't accessing those services because of where they were located in Lancaster. So those of you that will know Lancaster, and obviously I hope that's probably all of you, the treatment centre was on Great John Street on the one-way system. It's next to a pub, which isn't ideal when people are going for alcohol-related issues. And what we were finding was a lot of professional people who were looking for either low-level support or even crisis support just would not go into that building because everybody kind of knew, or the people that were hanging around it, they didn't want to be associated with it. So by moving those services into the GP practices, which is a safe environment, people came that wouldn't have accessed support before, and we've had feedback to say that. So they've been running for nearly 4 years now, and they're going really well. One of the other major health issues across Morecambe Bay, which quite surprised me considering we're a coastal town, is that we've got one of the highest rates of lung disease right across Morecambe Bay, right up to Barrow and Milham. We've got a number of groups that are run by the NHS that are 6 to 8 week set educational sessions, but we didn't have anything long-term that supported people either when they were waiting to go to those groups because they've got quite a long waiting list, but also when they'd finished those groups, there was no kind of peer support. And we know that peer support is one of the biggest things in any long-term condition for supporting people. So I set up a group which was called Airways, which I've put on there Breathe Easy, because hope to start them up again next March. We had to close them obviously because of COVID, but we're going to be calling them Breathe Easy. So we've set up Breathe Easy support cafes, which run monthly. We were running it at the Oak Centre at St John's Hospice. I think when we reopen, it's going to be the new Forget Me Not Centre. And basically, there was no cost involved. So a lot of the work that we do in the ICC, working with our partners, is we give things in kind. So basically, they gave me the room and the space. I put the group on, and we work together in partnership like that. So the group supports people that are on waiting lists to go into other educational programs around respiratory disease. Excuse me. What we also did was we provided a little bit of education. So we'd had pharmacists come, we'd have GPs come, other professionals will come and talk. But then what we found was really important was the group just getting together for part of that session and talking to each other and supporting each other and getting tips and ideas off each other. And we also used to, as you can see on the photograph, bring the local primary school children in and do some singing, because singing is good for the lungs. And unfortunately, we've been running it, just building it up for a year before COVID, and then COVID hit. So we've had to stop, but we are looking to restart that in March. I'm also one of the founding organisers with Ian Dewar, who I think you met a couple of meetings ago, of the Lancaster Health Festival. So that's been running since 2017. 2017, we started very small. We did it in Sun Square, and I think there was about 400 to 500 people came. We were supported by other community groups. Then in 2018, we moved it to the castle. We got the castle for the whole weekend at Lancaster. We organised a castle conga. I always like to do a fun activity that gets like put the public involved and draws people in. You might have seen it in the Guardian. There was various notices going out about it. So there's pictures there of the events that went on. What we also do is health checks. So in one of them, you can see we've got the police, we've got the Stroke Association, we've got fire, we've got health. Everybody came and was kind of there talking to the public about various things. And one of the other things that I organised is a community competition. So it started off, we wanted to include everybody in the health festival. So people that couldn't get there, so residents of care homes, we developed a community competition, which is a collage decorate. Well, the very first one we did, the first picture you can see was Pimp My Zimmer. So we did a Pimp My Zimmer competition and we put it out to all the care homes in Lancaster. We got 27 Zimmer frames back, all pimped. It was amazing. And the picture is of Nazareth House, who came first that year. Then what we've decided to do to make it a little bit easier is we do a collage competition every year. So we did that in 2018, and you can see some of the recipients getting their certificates for coming first and second. And we even had 2 residents of Hillcroft in the bottom picture come to Williamson's Park, where we put them on display in a big marquee, and that was one of them next to it at the bottom right hand corner. So that it's we want the health festival to be inclusive. We want everybody to be able to access it in some form or other, and the purpose of it is to just create spaces where people can have meaningful conversations, and that doesn't necessarily have to be about health. It can be about anything that it will impact and improve health and well-being. 2019, again, we were in Market Square doing health checks, and a lot of our partners will be there, people like Citizens Advice, the Fire Brigade, lots of different organisations. But we also put a schools day on in Williamson's Park. What we wanted to do was involve children, and I wanted to try and get some health messages across to children, because if you can change health behaviour at an earlier age, obviously it's better. So we started, the first one we did was with year 7s. So it was held in September. So a lot of them had just come up, well, they'd all just come up from primary school to secondary school, which is a bit of a difficult time for some children. So we invited all the secondary schools in Lancaster to bring all their year 7s up to Williamson's Park. And what we did was we put 30 different activities on. Some were physical activities, some were educational, and some were about mental health. And we had 500 children come, which was amazing. It was a bit like herding cats in Williamson's Park, but we didn't lose any. Well, we nearly lost one, but he turned up 10 minutes later, so it was okay. But at the event, all 500 children did 5 ways to wellbeing with Lancashire Mind. And they all did basic CPR training with North West Ambulance Service. And then they split off into different groups and did different activities. And it was a great day, and the weather was fab, so that was good. Obviously, in 2020, we couldn't have a health festival. We did a number of podcasts online and a number of speakers. What we also wanted to do was try and do something fun, because everybody was having a really horrible time. So we did the conga again, but we did it virtually. So we had a conga going from Barrow that finished in Lancaster. And there's just a few of the pictures of people that sent us videos in of the conga that they were doing socially distanced with their colleagues or with their friends. And we put the whole thing together and put it online. We actually posted it on the day that the health festival would have been, when we would have done it live. So we managed to do something, so that was good. And then this year we had a smaller, because obviously we were just coming out of restrictions, we had a smaller presence in Dalton Square. It was at the end of July, and we also had the community competition. And as part of that, so it was Lancaster Castle was the collage this year. We managed to get the Story Institute, and we displayed them all there for the public to come and vote on them. And we had a number of the schools and about 3 of the care homes come up as well and bring their residents. So it really boosted everybody's well-being, and everybody absolutely loved it. So we're working on next year's already. These are just a list of other initiatives that we do. I won't go into detail on all of them, but I'll run just through a few. So we do weekly multidisciplinary team meetings in the GP practice, where we bring together fire, police, GPs, social services, mental health, and charities like Age UK, supportive charities. Excuse me. and we talk about some of the most, we come together with consent and talk about some of the most vulnerable people in our community and how we can collaboratively support them. I helped set up a mental health support group that runs in the Cornerstone at Lancaster called Social Ease, and it's run by a lovely girl called Keely. I helped a Morecambe group, the Well Community, set up an eating disorder group. We do farmers' health checks up at the Lancaster Auction Mart once a month, finding an awful lot of undiscovered and undiagnosed ill health. As you can imagine, farmers do not look at, by their own admission, don't look after their health. So knowing a few farmers, I asked them, would it be beneficial to come and do health checks at the auction mart where they all gather on a Friday? And we've been going, apart from the little bit in the middle with COVID, we've been going now for nearly 3 years, and it's become really, really popular, and we're finding all sorts that wouldn't have been found. We also go to 2 of our community centres, Skirton and Marsh, and do community health checks at some of their groups there. We're bringing into the district, and this might be of interest to a lot of people, we're working with Lancaster City Council and Lancaster District CVS to bring a digital platform into Lancaster. So that will be a digital directory of services that will encompass everything. So I know we've got a number of things that you can access now around businesses and other things. This will be a platform that brings everything together, and at a touch of a button, and it'll be open to the public. Anybody can use it. There'll be a website, and people will know how to access support for mental health or sewing groups or dancing groups or absolutely anything. So we're hoping to launch that next February or March. I've just set up a 12-month programme in the community called Healthy Heart, Healthy Mind. We've got a local lady who's delivering a 12-week programme for people that are invited onto it who've got high blood pressure, and that's going really well. I've just managed to get some funding from the council to introduce a brand new role into the area, a parish nurse, which will be hosted by a local church. We don't know which one yet. They're putting bids in at the moment. And they will be specifically to support homeless people, but that doesn't just include street homeless. It includes care leavers, people at risk, people in domestic violence, refugees, anybody that's at risk or is actually street homeless will be supported by this parish nurse. I also support Hope Church, set up Bay Volunteers. So a few of you might remember during COVID last year, they set up the COVID Emergency Response Volunteer Service. We've managed to secure some funding for them to actually take on a volunteer coordinator, and we've renamed and rebranded it Bay Volunteers, and the new person starts in January. And what they're going to do is try and increase the number of volunteers. A lot of them have now gone back to work now that people have tried to get back to normal. But they will be coordinating a group and recruiting more volunteers to do things, low-level things like collecting shopping for people, collecting prescriptions, dog walking. We did, when the COVID vaccines first came in last Christmas, have a team of volunteer drivers. So we were taking people that just didn't have any way of getting up to the COVID centres to get their vaccines. And we're also looking to include digital buddies. So we'd like to train up some volunteers to help people access things like their GP apps or their GP appointment systems, that kind of thing. We're going to be developing that over the next year. I've also set up events for health staff in the area, training events on their, they call them, I can't think of the name now, PLT, it's protected learning time. And we've done sessions on dementia, social prescribing, talking about death and dying. I'm also part of the Community Conversations group, which we hold community conversations together with Lancaster City Council once a month for 6 months of the year. And they're about all sorts of different topics, not just about health. And I'm also part of a number of groups as well. I won't go through all those. But yeah, I've kind of like got my finger in a lot of pies. It's all about building relationships. So my contact details are on here. I just wanted to say that if anybody's got a particular interest in health or population health, I would love you to join our ICC. More than one, absolutely fine. We meet monthly, it's online, we send minutes out, we have lots of speakers every month, and it's kind of a really good networking opportunity and also finding out what's going on locally. And if anybody would also like to be part of the Community Conversations group, I can, if you let me know, I can arrange that as well. I think that's it. So thank you for listening. If there's any questions, or if you want to know anything more in detail, I'll either take questions now, or you can email me or ring me. That's fine.
Let's Sarah, if you want to take your screen down, we'll see if anyone's got any questions right now. So right, so who would like to start? And if you could either raise your real hand or put your digital hand up so I can see who wants it. So was that Jim? Did you want to, or we just?
Can you hear me?
Yeah, I can now. Yeah.
Yeah. You mentioned the Lancaster initiatives, and in particular the digital platform. And I can see the benefit of this because there's just so many groups, organisations to deal with here. But what did strike me, a lot of the people who would benefit from access to the digital platform are people who don't have the access or the relevant skills. And I'd just like to know how you engage with them and how they can engage with you.
Yeah, so the platform will be used by people that run the support groups. It'll be used by professionals, so people in the GP. It'll be used by lots of different professionals who are supporting the people, and they can use it as a signposting tool. So people that can't access it, they can actually tell them where they can just look up. They can be with a patient, a GP can be with a patient who is lonely or overweight or any number of things, and he can go on and put those things in and immediately tell that person what is available and where it's available. We're fully aware that a lot of people are not digitally enabled, and we're working with partners to try and change that or improve it. And like I said, one of the ways is through Bay Volunteers. We'd like to recruit some digital buddy volunteers that can go out and actually teach people how to use these things.
Thank you very much.
Okay, who's next who'd like to ask a question? Again, if you want to put your hand up or a digital hand. Anybody else? Well, whilst you're thinking about it, I've got a couple of questions. Sarah, you were talking about the health characteristics of Lancaster, and you mentioned alcohol and you mentioned lung disease. But are there any other particular outliers that stick out, that's above the average for Lancaster?
High blood pressure. And so we've got, so I can send, if you're interested in it, I can send you the presentation that kind of like shows what's going on where. But high blood pressure is a big one. I don't think that's exclusive to Lancaster, but it's after the two that you've already mentioned and poor mental health, high blood pressure is a really big one. And obviously that can lead to strokes, heart attacks, other more serious things. So we're trying to work on that.
And I presume that was why you had the healthy hearts and healthy mind. Yeah. Okay, so that's the second question I had was that, clearly the way you operate, you're really embedded in the local community. You've got lots of tentacles out there, and lots of links. But you also, during your presentation, made a number of references to COVID. The question I've got is that vaccine hesitancy, as opposed to anti-vaxxers, right? Vaccine hesitancy is still quite a big issue. And it's probably, I think, going to get a bigger issue because I think there's going to be a big debate about mandating vaccines. And I just wondered what thought, if any, have been given to actually using the connections and infrastructure you've built up to try and do something about that. Because a lot of the people you're connected into is what we've traditionally spoken about, the hard to reach group. So I just wondered whether you've given any thought or to that sort of area of activity.
Yeah, so I'm part of a vaccine inequalities group, which has only just been formed over the last couple of months, really. What we did over the summer was myself and a couple of the nurses from Lancaster Medical Practice went out with Inspire CGL, which are the substance misuse treatment group. And we took the van on the road and went out to all the homeless and supported living. So we told them in advance that we were coming. So we were going out and doing some kind of like proactive promotional work with the homeless. And we did manage to vaccinate quite a lot of our homeless community by doing that. Then we went out again 8 weeks later and repeated it. And we did get quite a lot of return people coming back, which was great. I'm currently speaking with the antenatal clinic manager at the hospital, the outpatients unit, to try and increase the numbers of pregnant ladies that
Right.
haven't been vaccinated.
Yeah.
So we are working on a number of initiatives, but it's kind of we've kind of just been, so I've also been working in the vaccine because I'm a nurse. I've been working in the vaccine clinics as well. So I think now we're getting the numbers through of who hasn't had it. We're now starting to target those people. We've kind of just concentrated on doing it en masse, and now we're starting to do a deep dive into who's not had it and what can we do about it.
No, that's really interesting because, I mean, obviously the work you've been doing over the last couple of years, you've been building up trust in a lot of these communities, and that's one of the problems, is that people just don't trust what they've been told. I know things more of an observation. I was really interested in your comment about how attendance at your forums jumped up when you started using Zoom, because that's a debate we've had, because we almost saw the pandemic as being an existential threat because we went with meetings, but actually because we've embraced Zoom, we've actually been able to get to more people, and it's given us more flexibility. So that's interesting. So I've given you a bit of time to think. So there are any other questions that you want to ask Sarah at the moment? Nobody's jumped.
I mean, the only thing I would add, if I could, is really you've covered a lot of areas, and you know, all credit to you, the diversity of what you are doing. You're asking for help clearly, and I mean, what is the best way that we could help? And you know, obviously we're recording this, we will put it out as well, and we will put that message out for you. So where, I mean, sorry, Shirley, you suggested earlier that one of us could perhaps join you in an area. I'd be happy to do that. But is there any other areas that you specifically want help with?
I think what's been really useful over the last 4 years for me is building up those connections so that you might not use them immediately or know or think of something that you would go to somebody for, but then 2 or 3 years down the line, an issue comes up or a project comes up and you think, I know who I'm going to go to straight away. And that's happened a lot over the last 4 or 5 years. So I think it'd be really good to have, I mean, I know I'm part of this group anyway, but it'd really, for me, be good to have somebody else from this group on our Icc partner distribution list that would come and kind of also get a feel for what we do and see where you might be able to fit in, but also as I get to know what you do as a group, I'll kind of then know what you'd be able to help me with. So it's all kind of new and a new ground and learning, really.
Yeah, I think that's good, Sarah, and I think it's great, David. You volunteered your services, and we're going to grab your hand off you by the Lancaster Vision. But I'm conscious that the colleagues here tonight, and more broadly, they're also involved in all sorts of other organisations. So I would encourage people, even though David said he'd like to be the Lancaster Vision Rep, I think if people would like to come along on the basis of their association with other organisations, I think, Sarah, you'd welcome that as well. Because I sort of get the impression.
Absolutely, yeah, absolutely.
The more the better, yeah. Okay, are there any other questions before we move on? If not, you've got Hugh, you want to...
Thank you very much for your presentation. It may well be outside your remit, but from my observation, the most pressing problem at the moment for would-be Lancaster patients generally is access to a GP. It does seem that at the moment it's almost impossible. Lancaster medical practice, whether or not they have problems with their switchboard, but it's virtually the only answer you get is we're not taking any calls. I don't know if this crosses your path or whether or not there's many specialised concerns are having similar problems.
It does cross my path. It's kind of not my speciality, but I do know a little bit. So last month, Lancaster Medical Practice had 3 times the amount of calls in the same month that they had in 2019. Now, whether that's a backlog from COVID of people not coming to the GP practice with whatever, I heard on a meeting earlier this afternoon from somebody from the hospital that they've got 3 wards full of people that do not need to be in hospital. They just can't find beds for them anywhere else. I think it's a combination of during the pandemic, people were isolating, people were getting COVID, so had to go home and weren't coming in for 2-3 more weeks. This is staff at the practice. Then they were put into bubbles, but then if somebody in that bubble tested positive, the whole bubble had to go off and had to isolate. So they've been constantly having to change the way they work, and they have set people up to work at home, but that's taken time to get going. So I think it's a combination of people being ill at the surgery, the staff having to isolate, but also the volume of calls that has come through has tripled pre-COVID numbers. So what they have tried to do, they're constantly trying to think about how they solve this. And it isn't just an issue. Lancaster Medical Practice does have a reputation of it being a bit longer, but I think they're all starting to experience the same. I know Ash Trees at Carnforth, you could get through straight away, but it's starting to take a bit longer. Queen Square, you could get through. It's taking a bit longer now. They're trying new systems on their website. They've got a new access that you can put your symptoms in, you name your symptoms, and somebody will triage it in the surgery and somebody will call you back. It's not widely known, but the more people we can get to use that online triage system for those that can get onto online, it would free up the phones while they try and sort out other solutions. But I know it's really, really difficult and it's very frustrating.
Okay, Jacqueline?
Sorry, it may be a kind of a partial answer. I can certainly vouch for the fact that the online system for putting something in and that someone gets back to you, it really does work. So I can recommend that as an approach. But as I understand it, the case now, certainly with Lancaster Medical Practice, that rather than them running their own switchboard, that it's coming from the hospital.
No, the telephone system was procured through the hospital, so they've got a procured system, but it's answered by their own staff.
Yeah, sorry, I didn't mean that it wasn't answered by their own staff, but that the way that the telephone system is configured, because it was procured via the hospital, was not necessarily what they would have chosen as a medical practice, is something I heard in the practice. I don't know the whole truth of that. They definitely did procure it through the hospital, so that might be right. Yeah.
Sarah, can I just go back to something that you said in response to Q when you were talking about the new system, the online thing, but you said it's not terribly well known. I mean, what's been done to publicise that? It seems to me it's an issue that's of a lot of local. It's all over the press, isn't it? You know,
yeah.
A lot of people probably have given up because they don't think they're going to be able to get through, which is. So I just wondered what was happening to try and publicise that, and again, was there anything we could help to do on that?
There possibly is, yeah. I mean, I know it's been on social media. I don't know whether they've sent a round robin out, or communications to all their patients. It would be a massive thing to do, bearing in mind that they've got like 67,000 patients, but. Yeah.
Well, if there's a message, if you could forward that to David, I mean, we'd be very happy to put that on our social. Because I just think the more people that know that he can get through it, and this is the best way of getting through it, I think it would be a win-win for all concerned.
Yeah, thank you.
I mean, I've got one observation on Lancaster Medical Practice, because it's something I came across the other day and I didn't know, and therefore it ticks a lot of boxes for me as the problems we've got. And that Lancaster Medical Practice is apparently, as I'm told, the third largest medical practice in the country. And one of the problems you get if you have a problem in a small practice, if you put it into a big practice, it compounds itself. It gets bigger, and I think that's possibly when you talk about the telephone system and procured through there. Very often you go, oh, this is excellent for us, you use it, and it's not fit for purpose what you actually want to. You end up with things which aren't appropriate. So I think there's a lot of work to be done there, and we're reaping the benefit of in one way the benefit of having such a large practice, but the detriments as well, I'm afraid.
Yeah, but no, I'll certainly pass that message on about and communication. That'd be great. Thank you.
Yeah, that'd be good. So, if there's no other questions for Sarah, can I thank you? I mean, that was really very
interesting.
I'd like to suggest that maybe next year you come back and because I presume your core funding now comes from the trust, that it's a permanent initiative. Is that right? Yeah.
Yeah.
Okay, so maybe next year we'll arrange to get you back and can tell people what, because I think you seem from tonight's reaction, this is the sort of thing that people are generally very interested in. So thank you very much for that. Right, so back to the rest of the agenda. So apologies, the only apology I've had is Sue Whitten, and sadly I learnt today that Sue's in the hospital. She's had a stroke, but I don't know how serious it is. All I know is that she's in the hospital at the moment, and I've certainly sent my best wishes, and I know a few other people have as well. So moving on then to
I've had a couple of apologies, and certainly it's got off my mind now. Quickly, Jill has sent her apologies through,
okay.
and also Howard and Liz.
And Brenda Harding, I sent you a note, David, on the chat. Okay.
That's right. Sorry, yeah. I saw that. Yeah.
Right. Okay, that's good. Thank you very much. So we've got the minutes of the last meeting. Are people happy with those? A true record of what we did? Okay. I don't think there's any matters arising that aren't on the agenda. If anybody spotted any, then stick your hand up. If not, we'll move on. No, I think you're all happy on that. Okay, the next thing we've got on the agenda is changes to branding. And it's a bit of obscure title. I better explain, and we'll explain what that's all about. I mean, you probably know that Lancaster Civic Society and Lancaster Vision have been on a bit of a journey over the last 18 months or so. We've changed quite a lot of stuff around, not least of which is doing the virtual meetings, but we've also very significantly, through David's superb help, radically sort of improved our websites and our social media presence. But the Civic Society generally still had a bit of a feeling we hadn't quite got things right. And one of the things that we encountered as a byproduct of the fact we were getting more of a profile was a bit of a confusion, because a lot of the key messages we were putting out, some of them were coming out from Vision and some of them were coming out from Lancaster Civic Society. And I certainly had a number of experiences with people saying, well, what's the difference? And are they completely separate? And what's the relationship? And it's all a bit confusing. So we had a fairly major debate within the Civic Society fairly recently to look at the whole future of where the Civic Society was going, how we could do things better, critically how we could get more people involved, because I've got a bit of a thing that certainly Civic Society executive, we're not careful, we're going to end up as an endangered species because the age profile is higher than we would like it to be. So we're particularly interested in getting more younger people, and by younger I mean under 60, in case there's any sort of dubiety about that. So basically, at a recent meeting of the Civic Society, we agreed a number of things which we're going to start putting into action at the beginning of next year. We're also going to do a sort of publicity campaign in the run up to that. So dealing first with the name, we had a big debate about the name. And the name of the charity is the Lancaster Civic Society. So that's the registered name of the charity. We're not going to change the name of the charity, but we are going to change our operational title, right? The way we brand ourselves. And then we had a lot of debate around the name, but the name we're actually going to use from next year for everything we do is Lancaster Civic Vision. Okay, we felt that now more accurately reflected the range of activities that the current Civic Society is involved in. Lancaster Vision as a sub committee of the will still continue to exist. We've got separate websites at the moment, but over a period of time, what we're going to try and do is merge those into one website, because again, what we want to do is show the totality of the range of issues that the Civic Society is dealing with. The social media platforms are a different matter, but again, we're going to move to more unified social media presence, but there are some complications of that, which I'm not going to go into tonight, but David's sort of advised us in detail about that. As far as meetings are concerned, you heard me mention earlier, Zoom had actually been pretty successful in getting people together. So we've agreed that in terms of civic society executive meetings and the meetings of Lancaster, we're going to continue to use Zoom as a primary medium. But the lectures that the civic society run, some of those, when we're able to, we're actually going to start trying to get real venues again, real meetings, and we're having a bit of debate about what the most suitable venues should be for those, because it's a general feeling that the town hall wasn't ideal, not least of which because of accessibility problems. There's a lift, but more often than not we get a phone call in the election to tell us that the lift was out of operation, which created a problem for a lot of the people that came along. All the press releases that we do in future will go out in the name of Lancaster Civic Vision. We're also going to be embarking on a pretty hard-hitting membership campaign to try and get more people involved. We've also given a commitment to try and increase our collaboration with a wider range of local organisations. I think it's fair to say that over the last year or so, we have had much more profile. We've had people approach us that hadn't happened in the past. And the other thing that people might be interested in is that the last Civic Society executive meeting, one of the things we had on our agenda was the City Council's recently published report of the Citizens' Jury on climate change. And we felt that as a civic society, that's something we really needed to embrace. So what we've done is we've written back to the council saying we generally endorse everything that's in there, but we've also agreed a number of operational principles, which David has begun to disseminate through our social media platforms at the moment. Because again, I think that's something that more and more people are becoming aware of and concerned about. I think it's right that a civic society or Lancaster Civic Vision should actually look at that very seriously. But also we think that it's something that might actually encourage people to join us, because it's something that a lot of people, particularly younger people, are very engaged in. Following this meeting, we're going to do a message out to the entire membership of Lancaster Vision. We did something similar with Civic Society a couple of weeks ago, but we wanted to just formally tell this meeting of what was going on. So I'm going to stop there and see if there's any questions that anybody has that you wish to have addressed about that. Nope. Okay. Well, we'll get the publicity out on that. So moving on. I just lost my agenda. Just for a second. Right. Projects update. First one on the agenda is South Lancaster. You all know what's happened there. You know the council signed the housing investment funding agreement. You know that could potentially lead to more than 9,000 new houses in South Lancaster. You know that we took a view both at Vision and at Civic Society. That was another good example of the confusion, two separate messages going in which were the same from two supposed different organisations. We took the view that we neither opposed it or supported it, but we thought it was ridiculous that a decision of this magnitude was taken with such little public consultation. Ironically, we then, and as you may recall, there was a lot of debate around the fact the decision had to be taken, had to be made by the end of August this year. We then discovered through a report on the council's cabinet that, and this was in October, that actually the decision hadn't yet been taken, they were still finessing it. It hadn't been notified, it hadn't been actioned. So we wrote to the chief executive saying, well, this is a bit strange. He said that this was all had to be agreed, blah, 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 signed. Sorry, that's the word I should have said. The argument was the agreement had to be signed by the end of August. They agreed it on something like the 25th of August because they had to sign it by the end of August. But it transpired it wasn't signed by the end of August. It wasn't signed in October. So when we picked up on this, I wrote to the chief executive saying, well, what's going on? You've told us it had to be signed, it wasn't. And I got a whole load back saying, well, no, we had to take the decision. We've decided not to have a big fallout of that because actually it doesn't add anything to the agenda. And there's going to be lots more debate on this. We've got a meeting organised with Cloud, the action group, because they've got some ideas about what they're going to do next. Our objectives are a bit different to that. I'll stop by saying this is far from over because there's going to have to be a planning application for the new highways works that they're going to have to do. And there's going to have to be lots of planning applications in the years ahead. There's going to be a master planning exercise for the Garden Village. All of those things will require consultation, and all of those things we will be involved in, and we will have things that we want to say. So I'll stop there in South Lancaster and see whether there's anything that anybody wants to say about that or ask. No hands going up.
Jacqueline's.
Sorry, Jacqueline. Sorry.
Just very quickly, the plans that the information that I have looked at does not seem to incorporate any kind of community provision. Has anybody else picked that up? I'm concerned, right. For example, some kind of community hub which might have a school, a health centre, social space, worship space, multi-purpose usage.
I can try and help with that. Certainly in the consultation exercises with, trying to remember the JT planning, JT planning, who were the consultants that did the master planning. There's quite a lot of debate about, and the Garden Village will have to include community facilities. But the Housing Investment Fund bid that I mentioned, right, which is shed load of money, as well as the transport infrastructure work, there's reference in that to essential community infrastructure. Now, we've not seen the details of that bid, it's been kept confidential. We don't know what's in there, but there certainly is a commitment given that the developments will include the necessary community infrastructure. And be rest assured, we will be holding people's feet to the fire on that issue, because that is going to be critical. Okay, Sarah, do you want to help?
I was just on that, because what concerned me obviously was the healthcare provision. Obviously, we've already talked about how overstretched we are in the area and how you can't get through to a GP now. So I spoke to Lancaster Medical Practice about a month ago about it, after I'd been on the meeting here actually, and just said, have you been in any talks with anybody about expanding the service that you've got at the university or setting up a new one? And they hadn't. There's been no talks and no,
What a surprise. Yeah. So as I say, this is going to run and run. And I mean, my personal, I've got a view the council made a big mistake in not more consultation on this, because I think they could have got much more buy-in from the community, because they actually did have a very good story to tell, but because it was so rushed, the story was lost. But anyway, that's a loss.
And what bothers us as well is the fact that it's not, I mean, they're quite happy to set up a new practice in a new village, we could do that, but it's where do you get the GPs and the staff? We're already struggling. We can't recruit GPs and staff now, so I don't know where they're going to come from.
Exactly. But as I say, there's going to be lots more discussion about this, and we're going to have lots more involvement in this. Moving on, Eden North. Planning applications. Then we normally, Hugh's normally the author of all the responses that go in from the Civic Society on planning applications, and a really good job he does too. But Hugh actually approached us about the Eden North project and said that in light of the magnitude of the project, they prefer that something came direct from the Civic Society executive. So we put in some comments which were very sort of positive about it, and basically urged that the council not to lose this opportunity. There are issues, but we urged the council to actually try and find ways of resolving those issues. So, something that could literally be a game changer for Morecambe, Lancaster and the entire Northwest, quite literally, not lost. Interestingly, our comments have been picked up. We got some coverage by Civic Voice, which is a bit of an umbrella organisation for civic society. So it was quite gratifying to see that some of the stuff we're doing locally is having ripples elsewhere. So beyond that, there's nothing I can add to the Eden North story. I just hope it is approved, and I desperately hope that it happens. Any questions or observations on that? No. Okay. Canal Quarter, it's all gone quiet. I know they've appointed consultants to work on the master planning exercise. So far, we've heard nothing. I've still been, I've bored you at previous meetings about us pushing for social housing on the, not social housing, community-led housing on the Canal Quarter site. I've had a couple of meetings with senior politicians about that, and there is a great deal of sympathy on that, but no decisions have been taken. So we're going to continue to push for that. And then moving on to that, Digital Lancaster. And again, on that one, it's been all quiet. There's been no meetings, there's been no discussion. So I really can't tell you very much more on that. So are there any questions or observations on anything I've said so far on that? Yeah, Sarah, again.
James, just on that Digital Lancaster, who were you speaking to?
Right, but basically what happened was, Mark, can you remember his name, David? Mark Thwaites.
Yeah.
Was employed by the county, right, to do work in Digital Lancaster. And then it all seemed to come to halt. I went to a couple of launch meetings, tells you how long ago it was, because they were real meetings. And basically, there was lots of ambition about it, lots of spoke down. They all just seemed to have gone quiet.
So I got asked to go to a meeting with somebody from Lancaster City Council who was leading on the digital strategy for Lancaster City Council.
Right. Okay.
And myself and my colleague from Morecambe went, and there was another lady who's one of the, I think she's chair of the Lancaster District CVS. He's now left, so that's why it's all gone quiet. If that's the same. If it's the same programme of work,
yeah, it's the same programme of work. Well,
he's moved on, and Louise Chapman, I think she's called Claire Louise Chapman, was the only lady left, but she's an independent businesswoman who was just working on the strategy with him.
Well, that's helpful to know, so that explains it. Moving quickly on, transport update. Amy and Richard, is there anything you want to tell us about?
I was just unmuting. So on the roadside, I don't think there's anything other than to note, which I think we knew anyway, that just related to the whole bridge piece, planning consent was given for the Loon Industrial Estate expansion, which was a key driver of that particular need. I know trains or rail, shall I say, is Richard's province. But I just wondered, I think I circulated a few weeks ago, the fact that Northern are inviting consultation on their timetable changes from December 22, I think it is, which concerned me in the sense that the last through train back from Manchester to Lancaster is now going to be something like 9:25 in the evening, which seems ridiculously early for such a major city like Lancaster, having a direct service back from our major northwest hub and other aspects. So it'd be good to perhaps have a quick conversation about, do we feel that's something that we should be picking up?
I mean, I think it is, right? Does anybody disagree? Because I think, clearly, 9:30 is a very early time for last train. So if people are people happy for us to make representations then? Yeah, Richard?
Yes, I've raised it with Travel Watch Northwest, which is a pressure group towards improving rail services, and they're going to take it up. But the more pushing from different sources we do, the better. So I'd be very happy for LV to take the issue up, yes.
Well, if somebody who is technically more knowledgeable than me can send me a script, I will happily write and the contact details who to send to. I'm very happy to draft something based on, what you guys, you know, and more about it than I do, say, I will send it off. Yeah.
Okay.
Okay. So I don't know, Richard, if you've already done something, could you sort of cut and paste that, and could we use that?
Yes, I'll certainly see what we can do.
You
I'll
do
certainly send you something anyway, James. Yeah.
That would be great. Oh,
Marvellous. And before we move on, James, because I could see you keen to move on. Sorry. Is there any further developments on the HS2 piece and the stopping pattern? That seems to have gone very quiet.
yeah, I mean, David, do you want to? Because you've
No, there's nothing further. All we've had is we've had Mark Cassidy's letter that he's written, and they have more or less said, the City Council have more or less said that they're happy for us to make representations. That is what I think we now ought to be doing, I've got to be honest, because I think we ought to be making a bit of a hoo-ha about it. But I still think in my mind that we ought to be, you know, putting the whole lot together. Yes, we should be making representation to HS2, but we ought to be looking at this damn ridiculous thing from Lancaster into Morecambe, you know, this trundling through on antiquated, whichever way you look at it, diesel or tube trains to a new thing like Eden. And yes, obviously, we should be looking, because of that particularly, we should be looking at the links that, as you've talked about, you know, from Manchester and everywhere else into. And the one thing that I think we can even have a really substantial campaign about is, I do not believe the argument that it is not possible to extend Lancaster Station to achieve 400-metre trains and therefore have HS2 stop in there. I think that what we're seeing is, you know, a bit of a bluff being put up to, oh, that'll do, just say that and that will get it out of the way. And I think that, you know, we could mount something fair, but I think the whole lot needs, or, you know, it needs.
David, hold that thought. I want to bring Roger in because Roger's indicating he wants to speak.
Yeah.
I was only just going to say that you've never been able to see a show in full in Manchester and catch the train home. And if it's a choice between later trains from Manchester or an hourly service direct to London, I'd rather have the hourly service direct to London.
Right.
From my point of view, quite frankly, I see no reason why we shouldn't have both.
Yeah,
conflict.
Yeah, Richard, I'm going to bring Richard in, and I'm going to try and tie it together with a suggestion. Richard.
Just an aside, I'm very impressed with this halo that's appeared behind David's head. However, to move on,
I'm not going up just yet.
No chance. Yes, I was. Well, we have some renewal now, changes last week or so to HS2. Luckily, these seem to be mainly on the East Coast, and they don't affect the through trains, which HS2 will hopefully run from London to the northwest. In fact, there is some hope that he mentioned, if it will come to it, who knows, that there would be an upgrade of the West Coast main line. And I think that this is very much needed, because really we've got to a situation where between Lancaster and Carnforth, the thing is over committed. With 41 more trains than we have south of Lancaster on the same two-track line. The new Leeds timetable, I understand, which comes in on the 12th, will now have 8 trains a day from Leeds, which is an improvement, which is 2 more than they had last year. But an attempt to get a commuting service to Morecambe has failed because Northern are not allowed any path between 8 and 9 o'clock between 4 Leeds trains between Carnforth and Lancaster. They've solved this because luckily there is a Barrow to Manchester train already operating in that period, and they're putting on a train in the morning from Leeds or Yorkshire. I think it starts at Skipton, but it will link to Leeds, which will connect at Carnforth. So people will have to change at Carnforth, but can get to Lancaster in time to go to work. It's an improvement of a sort, but it highlights the need for widening that line. And particularly as we're talking about the Eden North project, where we want a better service to Morecambe, both from Lancaster and from Leeds and anywhere else, that there just isn't the capacity at the moment. So I do think we need to press for something to be done to improve the main line between Carpeth and Lancaster at least.
Okay, thanks for that, Richard. I mean, my perspective on this is that I think David's absolutely right. I mean, I think we should have high level of ambition around this, because if we don't ask, we're certainly not going to get, right? And it also seems to me there's a number of strands in this transport debate we've had over the last 12 months or so. I mean, I think we're fortunate that we've got a number of people involved who are pretty knowledgeable in this field. And what I would like to suggest, well, I'm going to ask you whether you think this would be a good idea or not, is that we actually try to put together a small group to actually try to put together, for what a better word, an integrated transport strategy, all the things that we actually think we need, how they connect, how we see them being absolutely critical to the future, not just of developing the district, but actually safeguarding us, yeah? And actually trying to use that almost to capitalise on the never-ending levelling up mantra that we get from government on a monotonous basis. So what do people think about that as an idea? And we a few of us get together and try to put something together. David?
I fully agree with this, because I think my feeling is, and this is my feeling, my words are coming out, I think that Lancaster City Council's ambition is very, very low. And Lancaster Station is going to be pivotal to this for two reasons. One is I think it needs improving because it needs to be able to accept HS2. But the second reason is when Eden Project North opens in 2 years' time, it's going to be there are going to be up to 4,000 people per day arriving in the area, and probably a third of those are going to be coming by train. And that means a third of those people, possibly more, are going to be turning up at Lancaster Station and trying to change to get a train into Morecambe. And then they're going to do the same thing in reverse. And I don't think Lancaster Station, under its present guise, can even cope with that, anywhere near it. And I don't see Lancaster City Council giving out one item at all with regard to this, except for putting a pub there.
Right. On that happy note, I like pubs, so
so do I, but not when there's 4,000 people going through the damn thing.
Right. So I haven't heard anybody say it's a bad idea to try and do something. So I'm going to assume you all think it's a good idea, right? So who would like to be involved in putting that piece of work together? So we've got Amy. Okay, we've got Richard, and anybody else? We've got John, right? Anybody else want to be involved in that?
I'm going to put my hand up, I'm not really.
Ryan, you've got Ryan, yeah. Okay, so we'll get, let me just write this down. So we'll get Brian, Amy, Richard, and Sean. Okay, so leave that with us. We won't do anything this side of the new year because people are going to be busy, but we'll try and get a date set up for sometime in January, do it by Zoom. But I just think it needs to be done, doesn't it?
It does.
Yeah? We'll regret it if we don't do it. Right, okay. Now, I've got the next thing on my agenda was key working group. I'm going to suggest we defer that because basically this was something that came out of the Civic Society where we had a lot of debate about what was going on in the key. Amy's already alluded to what's going on at Loon Industrial Estate. You know, we floated the idea of a new bridge, etc., etc., etc. We decided that we thought that we needed, again, an integrated strategy around that. We said it'd be useful to see if Vision agreed with that and where people put their hands up. But rather than press the point now, I'm going to let you think about that until the next meeting, and we'll return to this issue in January, if that's okay. And then finally, is there any other business, anything that anybody else wants us to talk about tonight? I'll take that as a no. So the next meeting's 10th of January. So thank you all very much for coming along tonight, and have a great Christmas and a great New Year, and we'll see you all in January.